Today's show is sponsored by strawberry.me. Do you ever feel like you're doing everything you're supposed to do, but you're still not totally clear on where you're headed? For a lot of nurses and nursing students, life can feel like a non-stop cycle of shifts, school, and responsibilities, with very little space to pause and think. But here's the thing. Success and fulfillment are built with clarity, with intention, and with follow-through. And many people get there with help. Coaching gives you a place to talk things through, whether you're feeling burned out, trying to set better boundaries, deciding what your next chapter looks like, or just wanting to feel more confident in the choices you're making. That's where strawberry.me personal coaching fits in. Working with a coach gives you clarity, strategy, and accountability, so you can sort through what matters, identify what's been keeping you stuck, and take meaningful steps forward. When your thoughts feel organized and your decisions feel intentional, everything gets lighter. Working with a coach has helped me define my goals, focus on what's most important, and absolutely skyrocket my productivity. Go to strawberry.me/nursemo and get 50% off your first coaching session. That's strawberry.me/nursemo. Get coaching for your career and your life. It takes heart to build bodies that break records. Over the last 6 years, a team of incredible healthcare professionals did what most people thought was impossible. They rebuilt the body of legendary Olympian Lindsey Vonn after a series of devastating injuries forced her into early retirement. Now she's headed to the 2026 Winter Games, ready to break records once again. This February in Milan, Lindsey's team and the entire USA medical team will be wearing FIGS. You can rock their official uniform too. The new Team USA collection from FIGS is engineered with Fiber X, the most durable fabric yet. Fiber X is the new gold standard for high-performance scrubwear. It's lightweight, breathable, and ultra-resilient. And of course, the styles come in red, white, and blue. Check out the limited edition Team USA collection and get 15% off your first order at wearfigs.com with code FIGSRX. That's wearfigs.com, code FIGSRX. Well, hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. In this quickie episode, we are talking about the TR band and what this is, where you might see it, and some basics about the care of these patients. So if you've heard someone mention a TR band and you've thought, what is that? A TR band is a radial artery compression device. So we use this to make sure that the radial artery isn't bleeding after we've accessed it for certain types of procedures. So when a patient goes in for a procedure, like let's say they're going in for a cardiac catheterization and the interventional cardiologist is using the radial artery to gain access, then we definitely don't want that radial artery bleeding afterwards. So the sheath is pulled and this TR band is placed over the site to help achieve hemostasis after that sheath is pulled. So it is a clear plastic band with an inflatable dome that basically is inflated with air to apply pressure over that site to stop the bleeding and prevent any rebleeding. And then this dome that you can inject air into is adjustable. You will gradually be pulling air out as the patient is getting farther along in their recovery. So that's the basic overview of what a TR band is. You might be wondering when it is used. So again, it is used after that radial arterial sheath is removed, after that procedure is complete. They could just hold manual pressure on the radial artery, but that takes a while to achieve hemostasis. So this band can be applied and it provides that steady, consistent pressure to the site. So it helps the patient achieve hemostasis. It's probably, I would say, in most cases, more comfortable than having somebody press on your radial artery for an extended period of time. And when you're looking at radial access versus femoral access, which we will be talking about in the episode coming up on Thursday, diving a bit deeper into that, it is more comfortable for the patient and allows for earlier mobility when compared to femoral access. So you might also be wondering, well, what kind of procedures could potentially involve the use of a TR band? So they're going to be used after any kind of procedure that involves transradial access. So transradial cardiac access, vascular procedures, even cerebral. So a list of these could be things like diagnostic cardiac catheterization, even some procedures that involve intervention, such as angioplasty or placing a stent. And then there are other procedures done in interventional radiology that would use radial access, such as a cerebral angiogram. So, quite a few different uses. There's probably more. These are the ones that I see the most often in the facility where I work. But again, just know that the physician can go through the radial artery, travel a long way to the actual site where the intervention or the diagnostic study is taking place. So, after this TR band is placed and you're caring for the patient, you're really focusing on watching for bleeding, managing any bleeding that occurs, checking the patient's circulation in that site, etc. So, let's go through what this might look like. So, assessment wise, you're looking at that site very frequently, you're watching for bleeding. You're watching for hematoma development, bruising, all those types of things. You're also assessing perfusion distal to the band. Again, this is placing pressure on the artery. So let's pay attention to capillary refill, the color of the skin, the temperature of the hand, the sensation, are they able to move their fingers, etc. Now, in a patient who has healthy anatomy, who would have a TR band, they have the radial artery supplying blood to the hand. They also have the ulnar artery supplying blood to the hand. So a test will actually be conducted prior to accessing the radial artery, and that is called an Allen test. And that test confirms that there is good circulation through the ulnar artery. If you want to dive deeper into what that is, I have a whole episode about vascular assessment, and I do talk about the Allen test in that episode, and that is episode 274. So if you want to dive deeper into vascular assessment, go and check that one out. So, along with that, looking at your distal perfusion, which if your ulnar artery is in good shape, you are getting good cap refill, good skin color, good temperature, all of that. But let's say that there is some kind of problem, a bleeding problem, maybe there's a clot somewhere, then those things would be compromised. You're also assessing the patient's pulses and monitoring for pain, numbness, tingling, all those things that could indicate a complication. Now, your facility will have a different protocol, most likely for how this is managed. In general, you're going to start gradual air removal probably an hour or maybe 2 hours after hemostasis is achieved. And basically, that involves removing small volumes of air from that device at set intervals. So you're gradually releasing pressure in that inflatable dome, decreasing the pressure off that radial artery, and watching very closely for any signs of bleeding or hematoma development as you do that. And if bleeding does occur, then the general thing to do is simply reinflate that TR band back to the prior level that had hemostasis going just fine, right? So let's say that you started out and your TR band has 16 mils of air in it. You're removing a few mils every 10 to 15 minutes. A common amount based on the manufacturer is 3 to 5 mils every 10 to 15 minutes. So let's say you started out with 16, you went down to 13, everything was fine. You went down to 10 and you noticed some bleeding. Then you would go back up to 13 and see if that resolves the bleeding. And hopefully it does. The main takeaway here is that you're removing air very slowly and watching for bleeding as you do so. You want to make sure that the patient understands they need to keep their wrist straight. They're not going to be moving their arm around very much or at all while we are managing this device. They should report numbness, any pain or pain that is increasing. If they feel warmth or a popping sensation or notice any bleeding, they must let you know immediately. I mean, this is an artery. Arteries can bleed a lot. The patient can bleed out quickly. You want to keep a very, very close eye on these patients and make sure they know when to alert you. And they need to avoid heavy lifting and a lot of activity for whatever period of time is designated by their physician, probably like at least 24 to 48 hours. So that is your quick overview to the TR band in case you do see it. One thing I did not mention that I will tell you is that specific brand, the TR band, comes with a very special syringe. So don't lose it. It stays with the patient. It is a green syringe. It is the only one that will fit with the device. So make sure that it travels with your patient. So if you want to dive deeper into vascular closure management, then come back and see me on Thursday. We're going to get into the big dogs, talking about the femoral artery, the femoral vein being accessed in an episode on groin management. See you then. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Rinse knows that greatness takes time, but so does laundry. So Rinse will take your laundry and hand deliver it to your door expertly cleaned. And you can take the time pursuing your passions. Time once spent sorting and waiting, folding and queuing, now spent challenging and innovating and pushing your way to greatness. So pick up the Irish flute or those calligraphy pens or that daunting beef Wellington recipe card and leave the laundry to us. Rinse. It's time to be great.